Hi friends, this video comes with a lot of pain and distress for obvious reasons that last 2 weeks we've been engulfed with the grief, the pain, the anger, the disgust of the unwarranted suicide of our dear colleague Dr. Archana Sharma has brought in. There are many things to learn from this entire episode, right? But I would like to concentrate on one specific point which is bothering me ever since I heard this. And I've been thinking about it, talking to people. We are normal human beings who take a lot of pride and a lot of happiness when we succeed. We have wonderful successes, whether it's diagnosis, whether it is procedures, whether it is successful outcome, or who doesn't like adulation, right? But how many of us have the courage to talk about the complications that we face? Complications are unintentional. They are not medical negligence, right? It can happen to anybody. It happens to anybody, right? And that's a fact. The most important thing when we are faced with a complication is to just pick up the phone and talk to a friend, because that itself will diffuse a lot of things. The important thing is to not judge ourselves when we have a complication. If we stop judging ourselves, the rest of the world will stop judging us, right? But we don't feel confident when we have a complication, and that is the problem. When you have done the diagnosis correctly, you have done the treatment properly, and whatever in the limited resources you have offered what is correct to the couple, to the patient, what is there to fear about, right? So if somebody comes back to you criticizing for what you have, because that is the spur of the moment for them, the best thing for us to do is not to judge ourselves. Stop everything that you're doing, pick up the phone, talk to a friend, talk to a senior, talk to a compassionate individual who will just listen to you, you just vent it out. And that itself will go a long way in defusing the situation for self. In that spur of the moment, what was going through Archana's mind is something that we can all ourselves kind of make some judgments. But yes, could it have been something that could have been avoided had she just spoken to somebody at that moment of time when this thought of committing the suicide came to her mind? Is something that is bothering me. I don't know the answer to that question. I don't know whether it's right or wrong. But yes, there are situations where all of us have felt very dejected, very down, having not had a successful outcome or the outcome that we expected. And that spur of the moment is to just give up medicine and walk away, right? Some extreme case maybe to give up your life and walk away. But that is the moment of weakness. That is the moment that we need to conquer. That is the moment that we need to just pick up the phone, talk to a friend, talk to a senior, or talk to a compassionate individual. Just do that and let us discuss. Let us accept that we are just simple, normal, mortals, human beings who can have a complication. I would not even call it a mistake. We can all have that. It can happen to any of us. And let's not judge ourselves, the first and foremost thing. The rest of the world is up to them. Because only when I would feel inadequate about myself would I possibly take such a drastic step. And we should stop feeling inadequate about ourselves. You, remember, are the chosen one to do medicine and serve the people and serve the community and serve, the humanity at large. So let's not be judgmental to ourselves. Let's be kind to ourselves. Let us be humane to ourselves also. I hope this makes sense. Thank you. And wish you all health, peace in this whole turmoil of difficult healthcare environment that we are living at this moment of time.